A shortage of hospital beds in Western Cape is causing concern. The provincial health department is insisting things are under control, but people are reportedly being turned away because of bed shortages, and some patients are being sent home early to make space for others. Now, the department says facilities set up for COVID-19 use will cater for those who need medical care but are not sick enough to be accommodated at general hospitals. Meanwhile, healthcare workers protested outside the hospital as they want to be permanently employed. eNCA's Nobesuthu Hejana joins us now from Cape Town for more on this story. Nobesuthu, the Western Cape Health Department is putting to use its COVID-19 specifically built facilities. Please tell us how they're doing this.
So the department says it's trying to avoid to end up with the white elephant and the wastage of money because back in 2020 they did build quite a number of facilities where they were making way for COVID-19 patients. So those facilities, after the state of the national disaster was declared to be done, they were there sitting not in use. So the department says it's trying to ensure that it deals with the issue of the hospital bed shortages and making use of those facilities. So the Bracken Gate facility, which was also used back in 2020, will now accommodate about 128 beds, and currently it has a capacity of 80% due to the intake or the demand in referrals, because it's working with hospitals like Khayelitsha, where we've seen in the past patients sleeping on the floor and some not being admitted on the day. And the other hospitals that will also be feeding to that particular facility include Tygerberg, the Helderberg, as well as the Eerste Rivier Hospital. But we were there this morning, and the department says this is not the only facility that will be transitioned. There's quite a number of facilities within the province. They're looking at about 34 facilities. But let's take a listen to Dr. Karim explaining how this facility will work.
And the type of patients, they are people who perhaps have had a stroke and are post-stroke. So they're not well enough to go home, but at the same time they're not yet quite in the acute phase of the stroke. So those are the type of patients who would be admitted here. Also patients who require rehabilitation, particularly again stroke patients require intensive rehabilitation. So we've got a team of physiotherapists, occupational therapists, obviously a large contingent of nursing staff, and we've got a contingent of 5 medical doctors as well. Those would be the types of patients who would be admitted here. So patients who are recovering from an acute illness or patients who have complications from a chronic illness.
Now, Nobesuthu, the contracts of healthcare workers at the Bracken Gate Transitional Care Facility to an end. Who will look after the patients?
So we were there while the MEC as well as the officials from the Department of Health were holding a media briefing inside the Bracken Gate, just telling the media of how that facility is going to be operational. Some healthcare workers were outside protesting, so they are claiming that their contracts are coming to an end, month end, and by 1st of June, no one will be looking after those patients. But we did see that there were quite a number of patients that were actually being brought in, so which was a concern to other members of the staff that's working there. So the department says, unfortunately, it cannot afford to permanently employ all those healthcare workers that are working there due to the limited budget from the National Treasury. But it's saying that there's currently a recruitment process that is currently taking place, and through that they will be monitoring that to ensure that come 1st of June, those patients who have been brought in there will have people that will be looking after them. But let's take a listen to the union that was representing the people who were outside, just talking about their concerns and how those healthcare workers were brought in back in 2020. They acquired skills, but now they will be without jobs come month end.
The problem that we have is that these are the employees that are coming from the era of the COVID, since 2020 when this facility was opened. Now that the COVID is over, the department has decided to transform this into a transitional facility. For this 3 years, almost 3 years that they've been here doing excellent job. The Department of Health, headed by Dr. Noma French-Mbombo, who is the Minister of Health, has decided to replace them. And now they are here voicing their dissatisfaction and their grievance that they cannot work for 3 years, and after that they are replaced. Currently they are advertising their posts that they are occupying.
We are obviously going to keep a close eye on this one. Nobesuthu, thank you so much for your time this afternoon. That was our reporter, Nobesuthu Hejana.